Angelina Jolie, a beautiful woman who has been an international superstar, humanitarian, conservationist. And the question is, how has this woman been able to maintain her beauty over the many decades while in the business? Today we're going to explore together whether or not she's had any possible plastic surgery. Here we see Angelina Jolie at the age of 11, and what we're seeing is obviously a very beautiful oval-shaped face, distinctive eyebrows, her full lips, her nasal tip looks full. But what I see also is a little telltale droopiness of the left upper eyelid. It's possible she had what's called congenital ptosis of the left upper eyelid, or maybe it was an acquired ptosis, I don't know. But we're going to take a look at that in the future, in future photographs, to see if it's still there. Here we see her at age 16 in an angled view, and what we see is her hair is hanging over her left upper eyelid. Maybe it's concealing something that she doesn't want to reveal. You can see her lips are full, her nasal tip is again a little bit boxy, her brows are in beautiful position, and she has an oval-shaped face with very distinctive jawline and neckline. Now this frontal view from 1991 shows clearly that she has what's called an A-frame deformity on the left upper lid, okay, over here. And you can see that that V-shape, inverted V-shape, is due to a weakening of the internal muscles of the eyelid, okay? So she probably had this little bit of eyelid ptosis, again, a droopy internal muscle weakness. We're going to see what happens over time to that ptosis and if it changes. Here we see Angelina 6 years later, and we see clearly a difference of the left upper lid. The left upper lid crease is now higher than the right upper lid crease, and the contour is now smooth, a smooth arc on the left upper lid. It appears that she had a ptosis repair, which is this internal muscle repair, possibly a little bit of a blepharoplasty, which is removal of skin and other tissue. But it looks like the muscle itself internally has been repaired, and now she has the apertures of her eyes are symmetric, but the lid creases are slightly different on both sides. In addition, we have to now focus also on her nose. Her nose, her nasal tip, no longer has this boxiness that she had as a child, as a teenager. She now we're seeing a much narrower nasal tip, and it's possible that she had a rhinoplasty done to narrow the tip of her nose. In 1998, age 23, we can see there's really been what appears to be no surgical modifications of any kind. It's possible she had some Botox in her forehead. She has virtually no lines anywhere in her forehead or on her crow's feet. I mean, it's possible that she didn't have them at that age, but her forehead is very, very smooth. 1999, we do see a difference in the contour of her face. She no longer has kind of a round, full cheeks. Her cheeks look more contoured, hollow. It's possible that she has lost weight at this juncture for possibly an acting role, but I'm not sure. But she looks definitely different. She has a much more kind of a contoured oval shape to her face rather than somewhat of a round, wide face. If you're enjoying my analysis of Angelina Jolie, hit the subscribe button and continue watching. So in 2004, she's now 29 years old, and what we're really seeing is that she has some acne of the forehead, cheeks, and chin. But if we focus on her nose, we can see that her nasal tip looks much different. It looks like what's called the lower lateral cartilages have been narrowed. There's more distinctive highlights of her nasal tip, and the dorsum of her nose looks also more narrow compared to previous pictures. And here we see her 1 year later, and we can see that her nose is starting to settle in. It looks very natural. And it takes many months to years before the nose actually quiets down and settles down following a rhinoplasty. It's not an immediate thing. It takes a long, long time to kind of resolve the swelling and the changes. 3 years later, she, without any makeup on, she has very little change. She has some crow's feet that are showing laterally on her eyelids. Possibly they didn't do the Botox completely in the crow's feet, but it looks like her forehead is, again, very smooth, very few lines on her face, and she has good volume in her cheeks, and the contour of her neck and her jawline are excellent. 2010, we do see quite a difference in her face, and I'm going to start with around her eyes because what I see is a deepening of her upper sulcus here, and there's a little flattening kind of on the right upper lid in this contour here. It's no longer that arc. It's possible she had a blepharoplasty of her upper eyelid, which is to remove skin and maybe even a little muscle, sometimes a little prolapsed fat. And her nose, from this view, shows that her nasal septum has kind of bent a little bit. So her nose is kind of twisted a slight bit in the mid segment of her nose. It's kind of twisted over. So I don't know if things are changing. I don't know if she had that and it was well concealed by makeup, but that's what I see in this photograph. So 2011, we see again a change that has occurred. Again, she looks beautiful, but her eyelids look different. They distinctly look different, and it looks like, again, she's had some interventions on her upper eyelids. They don't have that flat contour anymore. It's not because she was closing her eyes before. Her contour is now kind of this oval arc. Actually, they're a little bit too open, believe it or not. They're actually not covering that much of the iris as a normal person, but they look symmetric, and it appears that she might have had some kind of, again, revision of her upper eyelids. Her nose in the midsection looks like there was a little bit of a collapse of the nasal dorsum slightly, because it looks like a little flattening effect. Even though we're looking at her on face, it looks like there's some kind of flattening in the midsection of her nose. It's possible she needed a graft done there, but it was kind of, when they narrow the nose, they collapse the sides of the nose inward, and sometimes they collapse further. She does not demonstrate any crow's feet in this picture, which indicate, again, that she's probably had that Botox injected on the crow's feet, on the forehead, and she has this contouring of her face, which is in this region. I don't know if that's a natural evolution of her facial features or whether or not there's been any alteration in terms of the fat in her face to create this hollowing, this sculpted appearance with high cheekbones and hollowing of her cheeks. Now Angelina is 38 years old, and we can start to see in the lower eyelids that there's some kind of tear trough hollowing, which is occurring in the inner aspect of her lower lids, and with her mid-face cheek fat pads starting to descend kind of inferiorly, slightly more on the right compared to the left. And this is, of course, normal aging at this point, and I don't see any further surgery. So here we see Angelina in 2015. She's unfortunately had to have her ovaries removed as a preventive measure to prevent ovarian cancer, because her mother died from ovarian cancer. You can see some of the mid-face volume is kind of diminished in this case, and I don't know if it's related to any hormonal imbalance that she might have at this juncture, but it looks like she's lost facial volume, facial fat, and there is some change going on there. In 2016, we see this frontal photograph of her, and we can see that there on the lower tear troughs in these areas called the tear trough, you can see it has like a bluish cast to it. And my question is, did she try to compensate for the facial volume loss that she experienced the year before with some kind of facial fillers? Because sometimes you develop what's called a Tyndall effect, which is a bluish cast due to these hyaluronic acid gels being injected under the skin. You can sometimes see that. 2018, we can see that she still has some volume loss in the mid-face area, and again, a slight blue cast with some makeup overlying it to camouflage the blue cast. Other than that, I don't see any change. She might have benefited at this juncture from a fat graft to the face rather than put in fillers. 2019, we see again a dramatic change in her upper eyelids. She has like this hollowing of her upper eyelids. The lid crease almost comes up to the orbital rim itself. I don't know if she's had further surgical intervention at that point, or this is just some change in the makeup. It really baffles me, but that she's gone back several times here to try to alter that. She shows this clear atrophy of her lower eyelids, which is loss of facial volume, again, from fat being lost. I think that she's a candidate for fat grafting at this juncture to compensate for the facial fat loss. 3 years later, we see that her upper eyelids look markedly different. There's some volume replacement in here. Her lid crease is lower. It's possible she had either a filler or a fat graft to her upper eyelids to compensate for the hollowing of the upper eyelids. Her lower eyelids, even though there's makeup that camouflages some of the midface volume loss, there is distinctly more volume there now, and again, it looks like she's had some fat grafting to the lower eyelids. Her neck and jawline are distinctive, very sharp distinction between the jawline and her neck, almost no laxity of her neck muscles. There's virtually no lines on her forehead or crow's feet. She's probably getting Botox ongoing, as I've said before. And another picture from the same year, again, we're seeing this full face volume change, which implies that there was some kind of augmentation there, either fat or injectables. Most likely fat injections were done to compensate for the volume loss that she's experienced. Now we see Angelina at age 47, and what we're seeing is she's still maintaining this good, beautiful contour between her face, her jawline, and her neck. Almost no sign of laxity of her neck. I would have expected someone at age 47 to start showing some laxity of the neck. She doesn't show that. On side view, what we do see is what looks to be a incision that started below her hair tuft here, trailing in front of her ear, and behind this little structure called the tragus, and down along the front of the earlobe, and probably trailing back of the ear, meaning that she had a facelift incision at this point, which is well concealed, but is helping to maintain her jawline contour and her neck contour in a more youthful way. In 2024, we're seeing, again, a very bright looking Angelina, virtually no lines on her forehead, no lines around her eyes. She looks thinner at this juncture. It looks like she has some atrophy in this particular area, right in this area, and that can happen following a facelift, believe it or not, by lifting the skin and laying it down. Sometimes volume loss occurs in this region, and it may be that she's just losing weight, but it's possible it's a after effect from the facelift itself. Other than that, her neck is maintaining virtually no laxity. She does have some horizontal lines of the neck, but that's been there for a very long time in her case. And but there's no muscle laxity there or laxity of the submandibular glands that is evident. And here we see Angelina in a frontal view from 2024. What is really striking again is her upper eyelids. Again, she has this hollowing of her upper eyelids that she didn't have in 2021. So the question is, did they go back again and remove some fat? So sometimes people are obsessed with every little tweak and trying to, the actresses and actors in the world always believe that they have to maintain their appearance no matter what, and they keep going back and back and back, and there's a danger for doing that. There's a danger that they go over the hill, so to speak, and cause secondary problems that can't be rectified. So it looks like she had some alteration again with her upper eyelids, or some of that fat that they put in to compensate for the loss of fat previously has now dissipated. It's hard to tell, but even her lower mid-face area looks a little more hollow. So it's possible that some of that fat dissipated, or maybe they removed it. I don't know. I hope you've enjoyed this analysis of Angelina Jolie, who has maintained her beautiful glow over many decades. I'll see you in the next video.